Bone fracture. What is bone fracture? A fracture is a break in continuity of bone, the same as a crack or a break. A bone may be completely fractured or partially fractured in any number of ways: crosswise, lengthwise, and in multiple pieces. Type of fractures. First, complete fracture, incomplete fractures, closed fractures, simple fractures, open fractures, comminuted fractures, transverse fractures, oblique, compression fracture, pathological, greenstick fractures. First, complete fractures. A complete break of the bone, causing it to be separated into two or more pieces. Types of complete fracture include single fractures, in which your bone is broken in one piece into two pieces. Example of complete fractures, look. And second is incomplete fractures. A minor fracture is also known as an incomplete fracture. When this happens, your bone doesn't break completely. Oftentimes, it's only a hairline cracks. Intense pain may also occur in the area and may be because when you move or touch it. Third, closed fractures. A fracture that does not break the skin. This is also called a simple fracture. Closed fractures does not affect the skin, only on muscles. Fourth, open fractures. A fracture in which the bone breaks through the skin and can be seen outside the leg, or there is a deep wound that exposes the bone through the skin. This is also called a compounded fractures. Or examples, this picture is open fractures, closed fractures. This figure is closed fractures and complete fractures. And fifth is comminuted fractures. A comminuted fracture is one in which the bone is broken into three or more pieces. There are also bone fragments present at the fracture site. These type of bone fractures occur when there is a high impact trauma, such as an automobile accident. 6. Transverse fractures. Transverse fractures are breaks that are in a straight line across the bone. This type of fractures may be caused by traumatic events like falls or automobile accident. And seventh, oblique fractures. An oblique fracture is when the break is diagonal across the bone. This kind of fractures occurs most often in long bone. It may be the result of a sharp blow that comes from an angle due to a fall or other trauma. 8. 8 is greenstick fractures. This is a partially fracture that occurs mostly in children. The bone bends and breaks but does not separate it into two separate pieces. Children are most likely to experience this type of fractures because their bones are softer and more flexible. And ninth, fractures. Compression fractures. When bones are crossed, it is called a compression fractures. The broken bone will be wider and flatter in appearance than it was before the injury. Compression fractures occurs most often in the spine and can cause your vertebra to collapse. A type of bone loss is called osteoporosis is the most common cause of compression fractures. Pathological fractures. A fracture that occurs through an area of disease of bone can occur without trauma or fall. Causes of bone fracture. Causes: first, trauma; second, osteoporosis; third, overuse; fourth, fall from a height; sixth, accident; seventh, fighting. The most common causes of fractures: trauma, a fall, a motor vehicle accident, or osteoporosis. This disorder weakens bones and makes them more likely to break. Signs and symptoms of bone fractures. Signs and symptoms: pain at or near the site of injury; difficult or movable to move normal; loss of power; deformity of or abnormal mobility; tendency, swelling, bleeding; unable to bear weight; obvious deformity; warmth, burning or redness. And other diagnosis of bone fractures. Diagnosis: X-ray, MRI, CT scan or PET scan. And treatment of bone fractures. Control the bleeding. First, stop bleeding. Treatment including immobilizing the bone with a plaster cast or surgical inserted metal rods or plates to hold the bone pieces together. Some complicated fractures may need surgery and surgical tractions.